series titled Demography and COVID-19 in Africa, Evidence and Policy Responses to Safeguard the Demographic Dividend. These webinars series are co-hosted by the Department of Social Development, Statistics South Africa in partnership with UNFPA, the British High Commission to South Africa, and the Foreign Commonwealth and Development Office, the African Union, Africa Center for Disease Control and Prevention, the African Institute for Development Policy, the Union of Africa Population Studies, and the Population Association of South Africa. The objective of this webinar series is based on South Africa's data analysis and understanding of the epidemic and lessons from the rest of Africa and other world regions. The webinar series seeks to create a space for sharing a demographic perspective on the impacts of COVID-19 with partners on the continent, considering its implication for Africa to reach a demographic dividend and achieve the Sustainable Development Goals. The outcome is that these webinar series will generate a level of consensus on core trends and findings among experts to formulate a set of policy options to recommend to national government as well of South Africa, as well as regional institutions like the African Union and SADC. Without further ado, ladies and gentlemen, I would like to take this time to introduce to you our moderator for this session, Ms. Shoki Chabalala, a Deputy Director General for Social Transformation and Economic Empowerment in the Department of Women, Youth, and Persons with Disabilities in the Presidency. She is a seasoned public servant who has served in numerous senior positions in both the provincial and national spheres of government. Ms. Shoki Chabalala is a gender activist of note. She is serving as a commissioner for the Commission of Employment Equity. Ms. Shoki Chabalala is a social worker by profession and possesses a degree in BA Social Work from the University of Zululand and a BA Social Work honors from the University of South Africa. And she has an executive management development. She has attended an executive management development program offered by the University of South Africa. She also has an HR certificate program and from the very same university with cum laude. DDG Chabalala I now hand over to the baton to you to proceed with the business of the day. Thank you.
Welcome you to the series on demography and COVID-19. Today's seminar is on South Africa's social and economic programs on harnessing the demographic dividend. Ladies and gentlemen, the year 2020 remembered as the year that heralded great global challenges, changes, reaction to the COVID-19. This pandemic poses multiple socio-cultural, political, and economic impacts in Africa, has amplified the challenges as regards education, health, and employment opportunities. This policy the policies that taken by the government in response to the pandemic have led to a slowdown in economic activity. Limited access to health care. The impact of these responses on countries that were expected to maximize demographic are yet to be assessed. However, it is that COVID-19 might affect countries already with low resources allocated to education and to health. I welcome you to this virtual meeting, the new normal of meeting. As someone who the show must go on, this debilitating contagion has crossed the entire world, including the future. It is on this quest that must find ways.
That's fine.
Must find ways and means of incorporating the continent's youth to realize the full demographic dividend and contain the perils modeled by COVID-19. Continued investments in education, health, entrepreneurship, wealth creation, rights, governance, and youth empowerment are called for. This scenario places on us the heavy task of shaping our demographic pyramids as a major step towards demographic dividends and not give a chance to demographic liability to become a reality and challenges the Africa we want. The aim of today's session is to assess how South Africa's programs meant to harness the demographic dividend have been affected by COVID-19, as well as highlighting programs that were initiated to mitigate the effects of the pandemic. It is expected that these experiences from South Africa are shared, and these will be compared to lessons from other countries with reflections SADC also shared in this session. This is an effort to achieve the AU's roadmap on the demographic dividend, which was endorsed at the AU Summit in January 2017, which puts the youth at the center of Africa's development agenda. As I conclude, ladies and gentlemen, allow me at this juncture to call upon Ms. Sere Karanja, Senior Research and Policy Analyst at African Institute for Development Policy based in Kenya, to give us a summary of the last two webinars. Over to you, Ms. Sara Karanja. May I hand over to Ms. Sara Karanja? Ms. Sara, are you muted? Check if you are muted. I will afford Ms. Sara the last opportunity. Ms. Sara, are you muted? Can you talk to us or can you hear me? Okay. In the interest of time, I would like to move straight to the speakers. We will find a way of bringing back Ms. Sara, but she's responding. She says, yes, I can hear you. Are you able to address us, Ms. Sara? Ms. Sara, I'm going to request that we move to the speakers and we will afford you the space because we can't hear you completely. Okay. Now we will invite our speakers. In terms of our program, we're supposed to have Ms. Nick Paul, but we will then rearrange our program. Our first speaker that will address us is Ms. Josephilda Nhlapo Sope of South Africa on social protection during COVID-19 in South Africa. Josephilda is an accomplished public service practitioner currently working at South Africa at the South Africa Department of Planning, Monitoring and Evaluation, where she has, amongst others, developed and institutionalized 5-year national sectoral development plans and strategies for social protection and social cohesion, developed smart indicators to monitor the implementation, and improved service delivery mitigated social crisis. She holds a Master of Arts degree in Population and Development from Erasmus University and an MBA from the University of Reading. Over to you, Ms. Josephilda Nhlapo.
Hello, colleagues. Can you hear me? Am I audible?
Yes, you are.
Audible? Okay, thank you very much. And now to put the presentation in presentation form. These things are way difficult. Okay. To begin, I hear that we've been given only 12 minutes. And so it means I really need to gallop along. The first thing I want to say that for South Africa, it is really easy to institute a very broad social protection regime because the Constitution demands us to. So, for example, Section 27 of the Constitution talks to right to access to social assistance. Section 28, it's about rights of children in relation to nutrition, shelter, and so on. Section 4 talks to welfare services, population development, disaster management, and then the Bill of Rights gives, that's chapter 2 of the Constitution, gives us all those rights that government must progressively ensure that all people who live in South Africa have. So right to housing, healthcare services, reproductive healthcare, education, food, water, and so on. And if you notice, that already is the beginning of ensuring a demographic dividend, because the population will have the qualities needed for them to be productive and so on. So from the Constitution, we go to the National Development Plan, which is a further articulation of the Constitution. And the National Development Plan 2 talks to the need to define a social flow as instructed by the Constitution to protect people against poverty and enhance resilience. So before the advent of COVID, South Africa is, the face of poverty in South Africa is black and female, and it is most manifest in former homelands, and where, though they have only 28% of the population, they have 40% of poor households. However, if you then include the social cash transfers, the extreme poverty reduces significantly from 26% to 8%. And then inequality, we know we've got the unfortunate claim to be the most unequal society, literally, almost in the world. However, that changes too if you take into account the redistribution via tax and transfers, as well as free basic services, the investment in health and education. So it declines from 0.77 to 0.596. So that is the situation before COVID. And what were our plans before COVID as articulated by the medium-term strategic framework? So what is the medium-term strategic framework? It is the 5-year plan, a drawing from the National Development Plan, which is up to 2030. So the 5-year plan, we were clear that we are going to improve access and quality for ECD, for basic education, we're going to improve the quality, and therefore the science and technology subjects there. We improve the quality of passes, we improve infrastructure as well. With health, we were clear that by 2024, at least 75% of South Africans will be covered by the National Health Insurance, which amongst its many baskets, it has also the reproductive and healthcare basket. And we also were going to improve access and ensure universal access to quality basic services, that's clean water and energy, electricity. We also were going to improve the efficiency and coverage of our social assistance. We discovered that with a child support grant, for example, the under twos that are in rural areas, in most remote areas, are not covered, and they need the grant the most, the child support grant the most. And then we look at the unemployment insurance fund. The efficiency is improving. People were being paid earlier, and the time between claiming and getting paid was shortened, but it only covers 5% of the unemployed. And then we were going to optimize the social welfare space by clarifying the partnerships and the financing models between NGOs and CBOs. In South Africa, the CBOs do a lot of the social welfare work that is supposed to be done by government. And then we all know that globally, the economy was not at its best. So what happened as we were going about our business, doing all of these things, COVID hit us. And it hit us, and we immediately got a lockdown. That was in March, April. So when it happened, we quickly went about protecting the most vulnerable from this scourge. So 166 shelters were quickly created for the homeless, and they were supposed to be given dignity packs, food. They even were supposed to have personal development plans developed for each of them, particularly because many abuse a substance and need psychosocial support. Institutions of the elderly and so on were closed to protect residents. Post-school education and schools were closed. The bad thing about closing the closure of schools was that it meant 9 million learners who receive meals through the National School Nutrition Program would not get food. So it was not only just an issue of the curriculum, but it was an issue of food and safety and so how was this then responded to? The curriculum was pruned for this year with the assumption that going forward in the next classes, the curriculum will be recovered. Exams were also moved to later, and because of the social distancing prerogative, the schools needed to platoon. So maybe children attend Monday, Wednesday, and Friday, and other children attend Tuesday and Thursday to enable the social distancing. Infrastructure grant that was supposed to be used to improve the infrastructure of some schools as per the school infrastructure norms. I'm sure you know that in some very remote areas, there are still no sanitation facilities. Some children still learn under trees and so on. There is a program to eradicate that, but unfortunately, because of COVID, some of the money was used to catalyze the water and sanitation and the purchasing of sanitizers and other personal protective equipment. And the grant that is given to pupils that go to higher and further education continued to be paid, and they were given laptops and data packages to enable online learning, and learning sites were zero rated, learning sites for both basic education as well as higher and further education. So what was the impact for COVID after all of this has happened was that we believe that it is still possible to catch up, and therefore the medium-term strategic framework goals still pertain. So we are clear that even special schools will have access to the required therapies by 2024. Coding and robotics curriculum will be introduced, and so on. The only challenge that we still have is that in South Africa, the poorest students have this NFSAS, this grant that enables them to go to a further and higher education with government paying. Unfortunately, if you are a child of maybe a nurse or a teacher or in the middle income, you do not qualify for this education grant. So that is a challenge. Maybe the nurse can afford to send one child to school, but if you've got two children, it means you have to choose. One child cannot go. So there's that issue of a missing a middle. Just to also add that the lockdown was not all bad, at least in terms of GBV, because the reports we received is at least the police received reports that both gender-based violence and other crimes were reduced. There's a debate that it could be that people were too scared to go and report, or they couldn't go and report because of the lockdown. But be that as it may, even hospitals reported a decline in needing to service people. However, the lockdown also meant that people could not go about their business of getting a food on the table. So what else did happen? The investment in health infrastructure was huge in preparing for the COVID onslaught, literally both in terms of infrastructure, but also in terms of human resources that went around screening, testing, tracing, etc. And maybe it is for that reason that South Africa has the third lowest mortality rate for COVID. So going forward, particularly with the health indicators, there is need to go back and look at the key child health indicators, including immunization and child mortality. There is a small, should we say, unsettling thought that in trying to ensure COVID is dealt with, the public, the usual primary health care could maybe have suffered. What else did we do with GPV? The GPV space was declared essential work, so work continued. Water tanks were provided. Then our social assistance security, our security agency, the one that pays grants and social assistance, also in trying to manage queues. Then staggered payments. So first it was the elderly and persons with disability, and then the rest. So that way they were able to ensure the social distancing, physical distancing. Coordinating structures were created for agile and swift, agile and swift response. And this is a very important, because in government there is a lot of silos. So everyone does what they need to do, and there's no talking. This at least got rid of the silos, and we're able to respond very quickly. And one of the biggest responses was the social security response, because, as I had said earlier, people could not go to work. So there was genuine hunger on the street. So the president then announced a once-off increase for the child support grant, and then agreed that from June, caregivers will be paid a 500 rand. And then he also said that people who do not work will receive this a social relief of distress a grant. Initially it was up to October, but because very little has changed, it has now been moved to January 2021. And then also time. I'm jumping.
Yes,
so
thank
all
you,
right. Social insurance, the UIF. Also was extended to people who did not receive UIF before. This slide basically shows that unemployment is so, should we say, is great that in some provinces 1 in 2 people live on social grants, and this one shows that it is the young people that received this a grant for people who lost their jobs. It's mostly the 20 to 24 and right up to the 54. And these are the people that are supposed to be productive in driving the demographic dividend. Food parcels were given as well. Why were the food parcels given? It is because due to COVID, Statistics SA projected that 50% of the population will be food insecure. Just to say that they were food insecure even before, 23.8% of the population, and with COVID this rose to 50%, and it is for that reason that the grants as well as the food parcels were given. I'm rushing. ECD, they were closed and then they are being opened slowly, but they need to meet certain standards, COVID-related standards. And then a survey shows that 83% of the operators have not been able to pay full salaries. They have not been able to pay the full operating cost, and they will, and 68% are worried that they will not be able to open ever. And this is not good at all, because this is where you invest here to ensure a quality population, if I can put it like that, a productive population. Here it's the impact, and I saw that Nisa's a presentation as this, so we can jump this slide. But basically we are saying that thanks to the social assistant interventions, hunger reduced. So how do we go forward? For the demographic dividend to happen, we must look at homeless people. A lot of young people particularly are lost. They are not able to contribute and make real the demographic dividend. We must prioritize ECD. We saw the impact of COVID on it, huge. We must improve governance for all our social security systems, particularly important. There was a lot of corruption around these interventions. We must increase the complement of social workers and social work practitioners. It has been a traumatized society, and we see this with, and once they're traumatized, it becomes very difficult for you to engage and become a normal, productive a member of society. We must ensure quality and access to the entire social wage, and the social wage includes the social assistance, it includes the basic clean water, electricity, education, and so on. We must find money for the missing middle and ensure that we implement the national health insurance and ensure universal coverage, as well as implement the economic recovery plan, because it's useless investing so much and yet people will not be able to articulate and live to their highest potential. Thank you very much, ladies and gentlemen.
Okay, thank you, Madam Josephilda Kaposope. I thought of requesting Madam Sarah come back and we afforded the opportunity to take us through a recap of the previous series we've had already. Madam Sarah Karanja, are you ready?
Yes, I'm ready. I hope you can hear me now.
Yes, we can. Over to you.
Thank you, and sorry for that technical hitch. So thank you once again for joining the third webinar in our 5-part series on COVID-19 and demography in Africa. After a captivating opening webinar that set the scene 2 weeks ago that focused on global, regional, and national experiences of COVID-19 and its demographic impact, we moved on last week to the second webinar in the series. This drilled into the service delivery aspects of COVID-19. It was moderated by the Acting Director General for Social Development, Linton Mchuni. We had 4 excellent presentations, 2 from South Africa and 1 each from Malawi and Uganda. This presentation illuminated various aspects of service delivery that have been affected by COVID-19 and various responses to these challenges. The speakers also went further to look at the possible short and long-term implications of COVID-19 on service delivery and the implications of the demographic dividend. So in the first presentation by Dr. Kobus Herbst, he took us through research from health and demographic surveillance sites in South Africa, which the South African Population Research Infrastructure, SAPRIN, has leveraged to evaluate the impact of COVID-19 on service delivery in the health sector. So one of the key emerging themes from this particular presentation was that while there was a lot of anecdotal evidence on the impact of COVID-19 in African countries, the evidence base is quite weak. It was therefore quite useful to see how health and demographic surveillance sites can be used to monitor and generate quality evidence on service delivery disruptions in the health sector without having to wait for periodic national surveys. This also complemented the administrative data that for many countries may have delays in report generations and also have gaps. The presentation demonstrated that the established health and demographic surveillance sites, a number of which we now have in Africa, can be a useful vehicle for rapid response to pandemics and provide insights on service delivery impacts from both population and health services perspectives. Crucially, the longitudinal surveillance abilities of population cohorts by the health and demographic surveillance sites make them an excellent vehicle to track the long-term impacts of COVID-19. The second presentation was by Dr. Nagudi of Wish to Action program in Uganda, and he shared some practical challenges to service delivery in the SRHR areas and innovative adaptation that they have applied in Uganda to overcome these challenges. So SRHR is one of the crucial sectors that has been affected by COVID-19 and has both short and long-term implications for the demographic dividend. So for instance, across the continent, there have been reports about a spike in teenage pregnancies, partly attributed to the disruption for SRHR services. The evidence from Uganda showed that service delivery challenges as a result of COVID-19 had indeed led to increased cases of unplanned and teenage pregnancies in Uganda. And I'm so sure we can all resonate with this from our various countries. So there was also increased demand for SRH services against limited supplies and increased cases of safe and safe abortion. Dr. Nagudi shared various adaptations they had deployed, including developing SOPs to ensure continuation of service delivery in the face of restriction of movement. They also realigned their budget to accommodate the COVID-19 disruptions, set up virtual platforms to aid communication and coordination, deployed an aggressive community mobilization and community campaign, and established a capacity building program. This program included training family planning methods users on DMPS self-administration. The third presentation was from Malawi by Dr. Joseph Nagoli, and it provided a demonstration of how modeling can be used to inform decisions by the government. The modeling was able to provide cost-benefit analysis of a strict lockdown regime versus a moderate lockdown regime. The analysis estimated the possible excess mortality under these scenarios, and importantly, the social and economic impact of such restrictions. Among the recommendations from this modeling activity from the exercise were taken up by the government was moderating social restrictions to avoid escalating both health and economic costs. The exercise also informed the reopening of schools to mitigate education loss. Finally, we had an excellent presentation taking on the pandemic from the lens of governance delivered by UNDP's Bongani Matomela. The study by UNDP in South Africa examined the state capacity to manage the spread and containment of COVID-19, and especially for the most vulnerable groups. The findings showed that the government will need to engage in review process to assess the effectiveness of their disaster management response and the governance arrangement put in place to mobilize and sustain it. More urgently, the government will need to find fast and effective solutions to deal with the health, economic, and social impact on citizens and non-citizens alike, and the effects of the containment measures taken to limit the spread of the virus. In addition, the study concluded that the government will need to provide workers and small business owners with the liquidity and strengthened income support for individuals, households, and families. At this point, I would like to take it back to the moderator, and thank you for giving me this opportunity to do the recap.
Okay. Thank you, Madam Sarah Karanja. I will then invite, we will take questions after all the speakers have addressed us. I will now take our next speaker, Maxwell Karakokwa, from the Directorate of Social and Human Development, SADC, to address us on regional response and emergency measures to maintain a continuity of employment. And Maxwell is a Senior Programs Officer under the Directorate of Social and Human Development at the South African Development Community. He previously served as the Chief Labor Officer in the government of Zimbabwe and has a wealth of experience on labor issues in the region. Maxwell earned his doctorate degree in development studies from Chinhoyi University of Technology. He also holds a Master of Science degree in international relations from the University of Zimbabwe. I'd like to hand over to you, Maxwell.
Thank you, Madam Moderator, for the introduction. Can you confirm if I'm audible enough and if the presentation is already showing up?
Yes, you are, and we can see the presentation, and you have 12 minutes, my brother.
Thank you very much. So thank you very much once again to the organizers for inviting us to this platform where we can share some perspectives from a regional perspective and also inform the audience in terms of what is happening, at least at the regional level, in terms of addressing COVID and having a sustainable way forward. So I just wanted to start with this slide where we are showing the SADC Vision as recently adopted by SADC in August 2020. So this is the vision that will guide implementation, guide activities, and everything that will be done under the banner of SADC for the next 30 years up to 2050. So we are collectively looking out for a peaceful, inclusive, competitive, middle to high income industrialized region where all citizens enjoy sustainable economic well-being, justice, and freedom. So lately we have been highlighting some two aspects of this vision, and those two aspects are in the words inclusive and the words all citizens, to show that as a vision in SADC, the idea to leave no one behind is at the core of everything that we'll be doing to build inclusive societies where everybody is included in the process of development. And then that emphatic statement to say that SADC will be about all citizens, not some of them, but all of them. So this is the picture and this is the vision as we'll be going forward. Now, to address the topic which was given to me, which is how member states have responded in terms of for guaranteeing or sustaining employment, it becomes necessary to at least have a bit of understanding of where we are or where we were as far as economic performance is concerned, because there's that strong correlation or that strong relationship between economic performance and employment, generally speaking. So you see that in terms of growth, our region has not been doing very well lately, and even since the global economic crisis ended, there has been some growth on average, but that growth is quite low. And as at 2019, you can see that we're sitting around 1.8, 1.9%. So this is to show that the impact of COVID was always going to be very great, because we're already not doing very well in terms of economic performance. So the hit from COVID, we expect it to be very serious. So what then do we have as an outlook now that we've been hit by COVID? So this is the projection from the IMF as at June 2020, focusing on how GDP is likely to be impacted by COVID. So you will see that somewhere in the middle, that's where we have SADC. The average negative growth is about 7.2%, and that's massive. So we're coming from a low growth performance to an absolute slowdown, not even a slowdown, but to an absolute decline in terms of economic performance at 7.2 for the region. But you will see that some countries are even larger in terms of the impact. A negative growth in Seychelles, for example, 14.5% expected. And you can see that for Seychelles and Mauritius, thereabouts, you are talking about the impact of tourism, for example, on those economies. So this is the picture. It doesn't look good. This is how we expect the region to be hit as at 2020. And of course, we expect that recovery will be slower, going to about 2023, 2024, thereabouts, until we can begin to see some growth trend, assuming, of course, that COVID is globally brought under control. In terms of the assessment of the risk as far as employment is concerned, the second column there after the countries shows you that we expect generally high impact as far as vulnerability on employment is concerned. So you have high for almost all the countries. Then you have medium for Malawi, medium for Mozambique, medium for Tanzania, medium for Zambia. But generally speaking, all countries we expect it to be high, the impact of it. And how are we analyzing this kind of impact? We're analyzing it in terms of how countries are geared in terms of economic performance, judging by the primary sector, the performance in terms of oil, for example, on Angola. That is the thing that is accounting for higher vulnerability relative to the other sectors. But then if you go to countries like South Africa, for example, you have a strong industrial sector, so we expect the impact to be high as far as the employment share in industry is concerned. And then, of course, you have a well-diversified economy where services are important for the economy, so we also expect a high. Then if you go in terms of the inclusion aspects by women and by youth, for South Africa, for example, you expect high vulnerability among the young people, because already before we talked of the crisis, the unemployment rate for South Africa for 2019, we have it reported at about 28% thereabouts. But if you check the unemployment rate for young people, for youth, you go all the way up to 58%. So the vulnerability there is very high. So this is how we are profiling the impacts of COVID on the regional economy. Then if I can choose some other countries, for example, in terms of social protection, if you check countries like Comoros, you have high risk. Countries like Zimbabwe, you have high risk. For Madagascar, you have high risk. This is because already the fabric of social protection for these countries was already weak. For SADC as a whole, you may want to know that, for example, in terms of social protection, as far as unemployment insurance is concerned, it is only 3 countries that have institutionalized schemes where you have public schemes that assure this benefit, and that is South Africa, Seychelles, and Mauritius. And so for all the other countries, when you talk protection in terms of unemployment insurance, this is left to the employer. There is no scheme. And in some countries as well, you don't have the legal guarantees in terms of gratuities and social protection in that form. You also talk in terms of sickness benefits. It is not all countries that have protection as far as that is concerned. So you see that the risk on social protection there is high for those countries that largely do not have institutionalized schemes of social protection in the region. And then, of course, you also have countries that are geared in terms of the contribution of remittance income in GDP. For example, for Zimbabwe, you have up to 20% of GDP being contributed by remittances. And then you see the impact of COVID and the impact that it has had on labor markets. You then expect a drastic reduction in terms of the contribution of remittances to GDP in those countries. And this is particularly high for Comoros. You also have Seychelles and Zimbabwe particularly. So generally, you then expect, having taken into account how our GDP in the region is structured by primary, by secondary, and by tertiary sectors, and the kind of fabric that we have in terms of social protection, you then aggregate this and you see that the employment risk and the vulnerability is extremely high for the SADC region. Now, why are we concerned about employment? Because we have, for most of our countries, this figure would be showing you that for a country like Tanzania, at the extreme left, you almost have full employment, so to speak. Technically, it is full employment because you have employment rates of up to 98%. The same goes for Madagascar, the same goes for Mozambique. Almost all the countries have bars above 90%, showing that employment is very important as a source of livelihood or as a source of income for our people, at least those who are in the labor force. But then, of course, if you go to countries that are more diversified, like South Africa, you then get a higher rate in terms of unemployment, as can be seen on the extreme right. This also explains that these countries which are more advanced, more diversified, they also have stronger fabric in terms of social protection, and to some extent it can be affordable to not be part of the labor force, at least fractionally. So this is to show that employment is extremely important for our people or for our region. However, we have concerns about the nature of employment in most of these countries, including those that almost report full employment, because this figure will show you that, I'll just summarize to say, at least 55% of all jobs in SADC are precarious. They are precarious because they are either based on informal work or they are based on characteristics that we term precarious, in the sense that for two categories of employment or classification in employment, this is unpaid contributory work and also on-account employment. For SADC, these two categories contribute to about 55% in employment of people who are employed, but employed as on-account workers and also as contributing family workers in the main. And already you see that this category concerns mostly the young people and mostly the women who are more represented in unpaid family work, for example. So in as much as employment is extremely important for our region and contributing in terms of the productive engagement of our people, you see that there are limitations in terms of the quality of employment. And this is the quality of employment that does not guarantee social protection because it is largely informalized. And for the left pen, they were showing the larger labor markets in the region, Madagascar, Mozambique, DRC, and Tanzania. And you can see that the rate of precarious employment can be as high as at least 80%, and this is concerning, especially for social protection. Now, in terms of
my brother, try and wrap up.
Sorry, come again. Sorry.
You are left with a minute and a half. Try and wrap up.
Okay, thank you very much. So in terms of what has been attempted in the region, it is important to balance between what is happening at the regional level and what is happening at the member states level. At the member states level, as you are aware, there have been stimulus packages. I won't go through them. You are familiar with this. There have also been measures to support enterprises through wage support, through provision of social safety nets and the like. And also, there have been measures to strengthen public health systems to ensure that the return to work is safe and to ensure that work methods can also include teleworking and shift working. And then there have been agreements in certain countries to have a moratorium or a freeze on dismissals or retrenchments. And then governments have also been inclusive in their approach in terms of getting everybody on the table. And for South Africa, you know that NEDLAC has been very active in terms of addressing these challenges. And then at regional level, this is the slide that shows the efforts that SADC has been putting together collectively. Firstly, we have adopted the guidelines on cross-border transport during COVID to improve surveillance, to improve tracking and monitoring and enforcement of public health measures, and also the mutual recognition of COVID-19 test results, whereby once you are tested and you get the PCR test, it is valid across the region for 3 days, and truckers or drivers can utilize this facility to move across the region and also to facilitate the movement of goods so that the economies can continue to go on. We've also activated a technical committee, which is including not only the health authorities, but Home Affairs, Finance, Transport, and players from industry to monitor closely the implementation of the SADC protocol on health. So everybody is on the table to keep an eye on what is happening and to come up with measures that are responsive as far as whatever is happening on the ground in terms of ensuring that the region maintains that solidarity and that cooperation. And then lastly, we have also supported at the regional level a resource mobilization where funders like the GIZ, the EU, the Africa Development Bank are contributing, and grants have been extended to member states to support procurement of medical equipment, testing kits, and so forth and so forth. Obviously, in recognition that full recovery and full guarantees for employment will need COVID itself as a disease to be brought under control. So these are some of the issues, these are some of the measures that have been taken at the regional level. And if you may allow me just 2 slides, I think this is very important. This figure shows you what has been happening in the member states within SADC in terms of responding to COVID, and that 68% shows you that the measures that member states have put into place, 68% of them have been new. There hasn't been that reliance on the social security fabric as was existing before COVID, meaning to say that we recognize that there has been a serious deficit in terms of social security coverage if we needed 65% of the interventions to be absolutely new. Now, once COVID is gone, it means that it is very unlikely for us to still maintain the 68%. There will be that deficit again, meaning to say resilience will need member states to strengthen social security or social protection systems beyond COVID. And this is one of the opportunities that we hope member states will take advantage of to make sure that the measures that they've put into place don't become ad hoc, but can be institutionalized so that the system is improved for the long term. I think I can end here, Madam Chair, and then in interaction, I can come back to some of the aspects that are important in terms of what can be done at the regional level, especially to improve value addition so that we don't export the jobs, so that we create local opportunities for our people here as we formalize as we improve our industrial sector, we can also bring down the effect of the informal economy as more jobs are created in the mainstream economy, especially in industry. These are some of the issues that we'll be looking out to at the regional level. Thank you very much. I hand over back to you, and we can discuss some of these things at plenary. Thank you very much.
Thank you to yourself, Maxwell. We really appreciate the presentation. We will then take our next speaker, who will address us on perspectives on the impact of COVID-19 on youth, and that is Lerato Murulani, Youth Advocate AFRIEN. And Lerato Murulani is a youth development advocate from Pretoria, South Africa. Her advocacy focus in the youth development context are in the areas of HR, HIV prevention, substance abuse prevention, LGBTI rights, and youth participation within the Sustainable Development Goal, African Union Agenda 2063, and the UN Secretary General's Global Strategy on Women, Children and Adolescent Health 2015-2030. Lerato serves as a member of AFRIEN and a board member at Partners in Sexual Health. You have 12 minutes, my sister, and if you see my camera showing, you must know it's a signal that you are left with 2 minutes. Thank you. Madam Lerato, check if you are not muted.
Oh, I'm sorry, I was muted. But I was saying that in my culture, we usually don't call you by name, so I wouldn't say Chair, but Galawahame for the opportunity. And I will actually note you when you've given me time to wrap up. But I've been given a task to actually speak on behalf of young people. I know that it's a huge task, and I hope that I will be able to grasp and present all of their all of their issues that they've been seeing during the pandemic and the lockdown. So one of the things that as young people we have actually experienced, and I'm echoing what the previous speakers have spoken about, is unemployment, which is the biggest issue among adolescent or young people leaving school and also who are just getting into jobs. So the effect of income and consumption, which speaks on issues of salaries, on issues of salaries also declining. Like there were most of the young people, as we have seen, that we have 2 million people who have lost their jobs since the lockdown has started, and most of those people were young people. And when we look at the SDGs, the aim of the UN was to ensure that we get 60 to 65 people who will be placed in jobs, which speaks about 34.2 million people in South Africa. However, 2 million people have already lost their jobs, which means that we are somehow going to miss the target that has been set by the Sustainable Development Goals. And as we all know that South Africa has a very high unemployment rate level, we also looking at most of the young people. They have seen that there is a disconnect between growth in employment and growth in labor force, meaning for people who are looking for jobs. So most of the young people during the lockdown, they have come up with valuable solutions, whereby some they create masks, some they just go out. We have the slogan that goes out that says 1 rand can make a lot. So you will have young people selling sweets for 1 rand. So those are the solutions that young people, as much as COVID has impacted us negatively and that we cannot run away because it's something that we were not prepared for, firstly. And it's also something that most of the young unemployed people or young people who have started their business were not looking into, especially businesses such as your Chisanyamas, or whereby it allowed people to have a large gathering. So that's why we have most of them closing down. But it also has impacted most of the young people, especially in mortality rate. You know, we have most of the young people nowadays, we are shocked when you get a 22-year-old, a 24-year-old passing on. And because most of the young people are not, they are aware of COVID, but they decided, some of them, to shy away from getting more information or not wearing their mask. It's something that we are aware of, and it forces them to get, or it ends up they end up getting infected with COVID, or they get COVID, and it leads to some of them, because they're not aware, they're not getting medical treatment, they end up passing on because of COVID. So those are the mortality, it's the mortality decline that we are seeing in terms of most of the young people. And also the biggest issue that we're facing also in the region, it's poverty. Most of the young people, it's been a joke, and we're making it a joke, that we are no longer broke. We are in poverty. We are living in poverty, because the brokenness doesn't define how, how unemployed we are, how hungry we are, and how, as young people who are breadwinners, because most of them are breadwinners, it's either they live with their grandmothers, or they live with their grandfathers, or they live with their parents who are not working. So they end up being forced to go out, and we call this macho mobile men with money, the blessee and blesser syndrome in South Africa, whereby you find that young people, they end up leaving their homes and getting blessers. And it's something that has been happening before COVID, but now it has increased, because people are seeing, as I would usually talk to my peers, and I would say that the blessers have actually seen a target, and that also pushes into human trafficking, because we see most of the young people that are trafficked, because they're thinking that going out there to get money to put, or bread to put on the table. But that could also change if we were to sit down in our different places and connect and talk as young people, have a collaboration also with the UN and also with the government on how we can actually make sure that, as much as the macho mobile money men with syndrome has been there throughout the before COVID, but we need to find a way of decreasing or just killing the scourge, if I can use that word for a lack of better word, because not only is it killing the economy, or it killing the share price in South Africa, but it's also killing the potential of other young people, because the very same young person that they are taking might be the next DDG. The very same person that they're taking might be the accountant. The very same person that they're taking might be the entrepreneur that will hire more than 10 young people or 10 people and boost our economy. So it's also the closure of schools that has been hindering our economy in terms of young people, because you get young people that were staying in reses, or who are staying in universities. You find that they have to go back home, and when they get back home, it's either they don't have networks. As much as the government has given people laptops, they give them data, but you find that there are places whereby they don't have internet, or they don't have network coverage, and it also places a huge role in terms of submitting assignments, submitting proposals, or submitting MES curriculum vitae. And if you go out or go to a distance, you go to a Wi-Fi spot whereby you can connect easily, chances of you getting robbed are very high, because people still, they need food. People still think that if they take that if they take your laptop that has been given to you, that you need by the government, they can sell it for like 1,000 rand, which will boost them at home. Because as much as we would like to commend and thank the government in terms of the food parcels and the social security funds that they've been given to young people who are unemployed, it's not meeting all of the young people, because some of them, they have actually been declined by the system. So those are the things that some of the young people, they end up resorting to crime to cover what they need to cover at home, which is not something that we should be proud of. That we need to also go back as young people, because we cannot be waiting for the government. I usually say we can't wait to be spoon-fed or being given the silver spoon. We need to come up with interventions. We need to engage as young people. We need to be innovative and come up with solutions that can actually assist, and we shouldn't wait for the government. But there is also an issue of inclusion of gender and youthful solutions. Like, for instance, the LGBTI community, when it comes to issues of sexual reproductive health and rights, they cannot access them, which also creates a big issue because, you know, in Pretoria, if I follow the data, we have at least 2 or 3 clinics that cater for the LGBTIAQ community, and all of the clinics, they cater for the heterosexuals. But if those clinics are closed due to COVID because they are funded by individuals, then it means that somewhere, somehow, we are missing the gap. We are missing those 18 to 35 years old who can be productive in the economy, who can boost the economy. So there is also a need to find a way on how we can actually look at all the LGBTIAQ clinics within the region and assist them. And as much as we are aware that there are other within the region that still see the LGBTIAQ as a taboo, and they haven't, oh my gosh, my time is about to end. This is so sad. But it's okay. I will just wrap up quickly. Yes, the access also to contraceptives when it comes to young women, because we've seen young them who are falling pregnant because they cannot go to clinics. Most of them, they would get them in schools, but as they've mentioned that learners now, they go to schools either on Monday and Thursday. They don't go to school every day. So if we could find a way of also, you know, getting back those peers, the people who are doing doors to doors in terms of screening, they can also cover that in terms of contraceptives and online conversations. So in my last 60 seconds, I would like to cover on what we have learned. So in terms of what we have learned, we can see that there is a need to access in hospitals, especially when it comes to contraceptives in terms of young people, because if we don't do that, then most of the young people will go back into relying into the social grant, and that creates a weight into the government, because the government needs to go back to the drawing board, cater for the next 2 million or more 2 million, which equates to 4 million, and the economy still now it's not in good space. Secondly, it's collaboration and have solid manuals for such pandemics. So we need to prepare ourselves for probably the second wave as it's coming. So have a solid manual and also make sure that we have a manual on how we can cater for young people, that as we've seen that most of the young people are suffering from depression. So it's one of the big issues. Most of the young people, others are not dying because of SRHR, but they're dying because of the issues of mental health and depression. So the others, I think I will cover, if I'm given time, I will cover them as we go on, because I still have to cover for the lesson learned and how we can go forward. Thank you very much, Ma.
Thank you. Kasotho, we say we will then find a way of allowing you to also talk to some of the outstanding issues as you respond to some of the questions during question time. May I just check whether we now have Mr. Nick Paul from the University of Stellenbosch? Okay.
Yes.
You will now talk us through the National Income Dynamic Study, Coronavirus Rapid Mobile Survey. And Dr. Nick Paul is a senior researcher in the Research on Socio-Economic Policy Group at Stellenbosch University in South Africa, and the principal investigator for the National Income Dynamic Study, Coronavirus Rapid Mobile Survey. His research and publications center on education policy in South Africa with a focus on early reading and early mathematics. Nick advises numerous trusts and philanthropies, as well as key policymakers in South Africa. Over to you, Nick.
Thank you, Chair. And just to confirm, you can see my slides?
Yes, we can, and we can hear you clearly. You have 12 minutes. I'm going to switch off my camera. If I start showing my camera, you must know that you're encroaching into your last 2 minutes period.
Noted, Chair. I'll try and stick to the 12 minutes. So thanks everyone for the earlier presentations. I'm going to do a short presentation about a study that we're doing in South Africa. It's called the National Income Dynamic Study Coronavirus Rapid Mobile Survey, or NIDS-CRAM. NIDS is a nationally representative panel survey that started in South Africa in 2008. And the aim was to follow individuals and their descendants every 2 to 3 years between 2008 and 2017. When when the pandemic happened, we got permission from the South African presidency to use that sampling frame, which is nationally representative, and use a telephonic follow-up survey asking them about their income, employment, welfare, grant receipt, education, etc. There are 5 waves of NIDS-CRAM, and we've done 2 waves so far. I'm going to talk to you now about the first 2 waves of the survey. We used 50 call center agents surveying people in all 11 official South African languages for about 20 minutes. And we gave them 20 Rand in airtime as to thank them for their participation. So if we look just in terms of the background, these are the 3 philanthropies that funded this survey, and the data is all publicly available on the Data First website. So if anyone wants to download it or download the questionnaire, you are welcome to do that. There are more than 30 researchers that are involved in the study from 5 different South African universities. So it's a very large research team. And each wave we release between 10 and 15 papers. So these are the 15 papers from wave 2, and they are all available at this link, cramsurvey.org/reports. And I'll paste the link in the chat once I'm finished with this presentation. I'm going to be presenting to you the main findings from the synthesis report. So the synthesis report summarizes all of the results across all 15 papers for those that don't have time to read all of them. So we do need to have some caveats that telephonic surveys, there are some limitations, including time and what you're able to ask. But by and large, we do see that the results are in line with the overall dynamics that we expect in the South African labor market and society. So the first one is that one of the forms of social protection that was rolled out in South Africa was a grant of 350 Rand per month for those that had no other grant and had no other income. It's called the Social Relief of Distress Grant. And this has brought millions of people into the social protection and social insurance system that previously were excluded. Now, the reason why that's important is if we look at child and adult hunger in South Africa, the first bar you see on the left was from wave 1, and the second bar on the right of each of these different combinations is from wave 2. And what we can see is that in the month of April, 47% of respondents said that their household had run out of money to buy food, and this has now gone down to 37% by June. But that's still much, much higher than the pre-COVID levels. So if we look at this graph on the right, the green bar, which represents the community survey of 2016, showed that in metro areas, so these are in concentrated urban areas, in 2016, only 16% of respondents said that their household had run out of money to buy food, whereas in April this year, 44% of respondents said that their household had run out of money to buy food in the month of April. So these are still more than double the figures pre-COVID. So while it's positive that the rates of hunger and running out of money to buy food are coming down, they're still more than double what they were pre-COVID. The second thing to look at is the geographical distribution. We can see that in rural areas, hunger was much more acute. So 1 in 5 rural respondents said that they experienced hunger in the last 7 days. And if we look at urban environments, those who live in shacks were far more likely to experience hunger and to run out of money to buy food, as we might expect. And if we look at the racial and population dynamics, we can see the apartheid legacy of race in South Africa and access to wealth and insurance being racialized in South Africa. So if we look at the different population groups, those who have been most affected by hunger and the pandemic are Black South Africans and colored South Africans. We also asked some questions around mental health. And what we can see is that the prevalence of depressive symptoms has doubled between 2017, which is the last time we asked this survey, and June this year. So it increased from 12% to 24% of individuals who tested or screened positive for depressive symptoms. The graph that you can see at the bottom left here is showing you the percentage that are screening positive for depressive symptoms based on frequency of hunger. So people that are experiencing hunger or reported that they experienced hunger either every day or almost every day, almost half of them, 44%, screen positive for depressive symptoms. So it's very clear that something like hunger and mental health go hand in hand, in the sense that if you have no money to buy food and if you are experiencing hunger, you are far more likely to experience depression. Another really important finding was that employment losses in South Africa have been very large. So between February and April this year, approximately 3 million people, 2.8 million people lost their jobs between February and April, and those jobs do not seem to have returned by June. So our hard lockdown was in the month of April, and we moved to level 3 lockdown, which is a medium level lockdown, by June. And you can see the graph on the right that the red sections increased dramatically between February and April, but then did not change. The one thing that did change was that there was an increase in what we call furloughed workers. So these are people who did not earn an income and worked no hours, but they thought that they had a job to return to. And it turns out that only about half of those who thought that they had a job to return to did actually go back to work. Now, I'll put those employment figures in perspective in a moment, but again, just to show the geographical variation of this, we can see that while there has been some bounce back between wave 1 and wave 2 in metros and cities, in rural areas, there doesn't seem to be a bounce back of employment. The second big finding in terms of employment is this is the percentage of job losses between February and June of this year by subgroups. So we can see that manual laborers, 30% of them lost their jobs between February and June, as well as about 31% of those who are in the poorest half of the population. If you compare this to the left of the graph, where only 3% of the richest quarter of the population lost their jobs. There was a 3% decline in net employment for the richest quarter. So it's very clear that COVID-19 is exacerbating our existing inequalities in South Africa, which were already very high. We recently also had another survey, a much bigger survey that Stats SA announced. And what they found was that there was 2.2 million job losses in South Africa this year, which is slightly lower than the 2.8 million that we report, but it's of the same order of magnitude and showing that these are incredibly large. In this context, I think that this quote by Lenin, where he says, there are decades where nothing happens and weeks where decades happen, is really pertinent in South Africa during COVID-19. So if we look at grants, over the last 10 years in South Africa, the social protection system expanded to include 4 million additional grant recipients. So it went up from 14 million to 18 million. Now, in the last 4 months alone, we've managed to add another 4 million people into the grant system using the new temporary social relief of distress grant. So it may go away, but it may be made permanent. We're not sure. If it is made permanent, this is a decade's worth of grant growth that has been accomplished in 6 months. Similarly, if we look at employment, over the last 10 years, we've seen that the South African economy has added 2.4 million jobs over the last 10 years, but basically we've lost a decade's worth of jobs in the last 6 months. So whether those losses are 2.2 million or 2.8 million is kind of not that relevant when we think that that's the equivalent of 10 years worth of job growth that has been lost. Now, there is a question about whether those jobs will return as we move, as the tourism sector opens, if a vaccine comes, if more people in the services sector are employed, and as lockdown eases. But we will only be able to tell that in wave 3, which is currently in the field, and we will be reporting on those results at the end of January next year / the beginning of February. So I think I will leave it there and just leave the titles of the papers that are up here for Wave 2, and I'll post the link to this. If anyone wants to read any of these, there's no gated access. The data is freely available. The papers are freely available. And everything from early childhood development to hunger, gender, and the different labor market dynamics are all available there. So I'll stop there. Thank you, Chair.
Thank you, Dr. Nix-Paul. And we will now hand over to our discussant, Dr. Shakira Kunara. Shakira Kunara is an award-winning independent public health practitioner, bold activist, renowned public speaker, and Operation Smile ambassador for South Africa. Her most notable appointment to date is to be appointed to the inaugural African Union Youth Advisory Council, a dynamic and budding social entrepreneur. Dr. Chunara is the recent founder of a development consultancy firm, budding social entrepreneur, and coming from a limited dedicated company to better healthcare, realizing a feminist agenda and ensuring young people succeed. She's a recipient of a number of prestigious awards, including being listed as the Mail and Guardian 50 Most Powerful Women, Destiny Magazine's Most Powerful Woman. I would like to now request that Dr. Shakira Kuna be the one that addresses us, but also I forgot to mention that she has a PhD in public health and honors cum laude and masters in demography from the University of Witwatersrand. Over to you, Dr. Shakira.
Chairperson, thank you for the introduction, and a quick apology to everyone. I have the sunlight coming in, so I may not be that clear, and there's not much I can do about that. But it's brilliant to check in this afternoon and also to come in to sort of bring all these incredible presentations and what the speakers have said together. And so I'll jump through as a discussant, and some of the points that I think really stood out from each presentation, but also where I think the rest of this discussion can really go, or at least suggestions for the rest of this discussion. And, I was reading an article on India a few days ago, and I think that South Africa within BRICS, we tend to look at similar trends, or we also have similar trends with our BRICS counterparts. And India, for example, which was going through a demographic dividend and reaping the benefits from the 1980s, due to COVID-19, it's foreseen that, the benefits of the DD may come to an end or put on ice. And I think that's something that South Africa has to consider as well. I mean, we've been struggling these past few years. There has been progress in different sectors, different parts of society, but overall there are big structural issues, which I think all of the presenters alluded to. Jumping straight in, I really found Josephine's presentation very insightful. In that she talked about the immediate impact of COVID-19 and government's responses to this. Josephine also highlighted for us what I really enjoyed was an entire life cycle approach for youth, because sometimes we either talk about children or we either talk about adolescents. And what Josephine did was talk about the children, ECD, and then also go into youth issues. But I think when we open up for discussion, what we need to unpack a lot more from this is the reality. So while government has had a very strong response, and it's been great social relief measures which were passed, etc., I think we need to also have a frank discussion about what the bottlenecks were, how the bureaucracy was, and even if we provided support to students for online materials, etc., we cannot ignore the fact that others were simply left behind during this time, and they will continue to be left behind. And so I think we need to unpack the realities of this presentation a bit more. When we go over to Maxwell, I think Maxwell painted a regional picture, and I'm always very passionate about the region, because I think that young people in South Africa, we can't just see youth as as you know, something within the national borders. I, for example, work throughout the continent and affected by COVID-19 with the inability to travel. And that, of course, affects my income. But I'm sure that there's so many others that are affected in this way. And so, you know, the closing of borders within the region affects young people in the way that we're no longer allowed to connect to each other, you know, really build on regional opportunities and collaboration the way we previously did. And we have had to reimagine things a little bit. But I think that Maxwell painted an excellent picture of what's happening in the SADC region. And it was quite interesting to see that, you know, the GDP is around 1.9%, and the picture is quite gloomy. And that worries me as a young person, but I'm sure it would worry all of us, and including our governments within the region. Maxwell presented, and I absolutely like the graph on the impact, and it highlights youth vulnerability. And I think that term needs to come out from these webinars into our policies, into anything we're putting together to address youth during this time, to build on the demographic dividend, is the impact and the vulnerability. And when we're talking about vulnerability, all of the speakers spoke about employment. And essentially, young people either struggle to find a job before COVID-19, it's now worse. Young people had education which was affected, especially in South Africa's universities, which are not as advantaged, the WITS and the UCTs. And, you know, that's the voice on the ground. And so this affects employment opportunities. And finally, young people are also in temporary employment or job insecure or face job insecurity. And so I think that term of youth vulnerability and impact is a measure we need to definitely take forward. I would say or add on, and I think everyone can, you know, sort of unpack this a little bit later, was when Maxwell presented the regional measures. I would say that one thing that was missing from the regional measures is that we need to urgently invest in young people, and we need to urgently create specific relief measures for young people at a regional level and national level, and I think this will be very critical. So it's always fun to be a discussant, you know, you can sort of thrash things out. And again, sorry for the sunlight. I think Lerato really brought together the first two presentations by showing us what the youth voice is on the ground. And that's one of desperation. The plight of young people is not just something we can talk about. Every single day, people are reaching out, they're unemployed, graduates are unemployed. It really is a desperate situation, and it's only gotten worse with COVID-19. I really like the fact that Lerato started to talk about SRHR issues, because I think within the demographic dividend, we've got to look at the terms of fertility and mortality. And she touched a little bit on the Blasser phenomenon and on contraceptives, but I think if we were to break down this a little bit more in our discussion, and this is again with the audience, is how are we affected in terms of the disruption to SRHR services? So I think that needs to come out. I think key to the DD is the sexual and reproductive health during these times. And, you know, this is not from South Africa, but I have some colleagues on the ground in Uganda who said that there was a district in Uganda where teenage pregnancy burgeoned during this time. In South Africa, even though the MECs and others have signed certain memorandums, there was disruptions to contraceptive services. Abortion services simply did not continue during the period. Gender-based violence centers were overwhelmed during this time. So I think when we're talking about the DD and young people, we can't let go of the SRHR issues. We have to unpack this a little bit more. And then finally, I think Nick sort of also touched a little bit on what Joseph Felder presented, and that was the fact that social grants are a lifeline in South Africa. And I think we're quite fortunate to have these relief measures. They really have meant so much to so many more people in the country. We cannot undervalue that. But then we also have to talk about the fact that a small grant is not going to afford any individual a ticket out of the cycle of poverty. And so it's something very small, it's appreciated, it's needed, but overall in terms of one's life trajectory, it's not the solution. And so we need to talk a little bit about that. One of the points that Nick mentioned was around mental health and hunger, and I thought that was fascinating because it made me think about the young people I work with who have HIV, and at least 80% of them that I've met, and you know, this is not a definite figure, but it's just sort of a mind measure of the young people that I've worked with, and what they've said to me or always reached out about was nutrition. And I think in this discussion, we could have talked a lot more again about SRHR issues, but HIV and TB, which are big causes of concern in South Africa and among young people, and talks about health. So that was sort of my overall feedback. And as I round off, there's two important resources I would push everyone to. And again, sorry for the sunlight. But the one I read this morning was by UNDP and the South African government. And this was the socio-economic impact of COVID-19 in South Africa. And it really raised two important issues. And the one was that women specifically are shown during this time to be highly affected by COVID-19. And so this puts us on sort of a vantage point going forward, saying that we need to have a youth lens and we need to have a gender lens. And we probably need to streamline this within all of our work going forward. And not probably, we should, we must. Another thing to keep an eye out for that I'm quite interested in is the HSRC, Human Sciences Research Council, conducted a survey on young people, and I haven't seen the results out yet, and I may be mistaken, maybe it is out, but I think those results are very important to build on and to continue to monitor. Finally, based on what some of the speakers said, but also the solutions we can start to consider and look towards and where we need to focus, I think it was Joseph Felder who talked about the NHI. And I think we've learned so much as South Africa and the public health front during this time. And that's going to be critical. NHI for sexual and reproductive health for young people, NHI for making sure that everyone has access. We've got to put the focus there again. The pandemic shifted the focus a little bit, or it's dropped the ball on the focus. The national youth policy is in the process of being renewed. But besides that, implementation has always lacked. And within this, the youth lens, the gender lens, and investing in young people, we need to also tie this to the youth policy. And finally, employment continues to be the biggest issue facing young South Africans at the moment. And we're making a little bit of a shift, but not enough. And I think that's got to be our focus point within, the Africa Youth Charter, the AU road to the demographic dividend, and everything else. Like Lorato said, the plight is really dire. So I'll end off there.
Thank you so much, Shakira. I will now open up the session for questions. If you are unable to talk or unmute yourself, you can use the chat box. Comments, if any, based on all the four speakers and a well summarized part of the series that we've had today. I'm inviting questions and comments, if any. There's a hand, Busiso Mpama. Any other hand? Okay, for now, let's take Sibusiso.
Hi, good day, Chair. Thanks for the opportunity. Thanks to the presenters for their respective presentations. But just a comment from me regarding the impact of COVID-19 on demographic dividend. The two things that spring to my mind is that the COVID-19 has disturbed the plans that we had, the government plans, the plans that the government had for this year. And in this regard, I'm talking specifically regarding the MTSF. It has, the COVID-19 has caused government and its partners to shift its attention from the MTSF, from the objectives of the MTSF this year, to now focusing on the pandemic itself. And then secondly, which is a very important point to understand, is that the outbreak of the pandemic has revealed the fault lines that were caused by apartheid. And it has, in revealing these fault lines, it has also revealed the urgency of trying to address the fault lines. And we see this with the provision of basic services. And you'll remember that at the beginning of a large, some sections of the South African population, especially poorer communities, were worried as to how they would institute basic hygiene measures, such as washing their hands, when they don't have access to clean potable water. And so this resulted in the government having to go out and acquire Jojo tanks. So, but my main point is that the COVID-19 has revealed the fault lines that were caused by apartheid, and in so doing has also revealed the urgency that is required in addressing those fault lines. Thanks, Chair.
Okay. Thanks, Sibusiso. It doesn't look like we have further questions or comments. Will you then allow me to request that we have probably Sister Sefilda, would you like to comment? The matter is almost linked to MTSF issues and how some of these fault lines got revealed, but also widened the gap, you know, between the poor and the rich. So I just want to check with you whether you would like to comment.
Thank you very much, Chair, and thank you, colleagues and participants. Just to say that I cannot agree more with what people are commenting on, because fact is that policy is different from implementation. It is for that a reason that the president, even before COVID, had mentioned 7 priorities, and his first priority was is a capable state, because implementation, there's a huge implementation gap in many of these policies. Just to also give an example that yes, maybe universities may have availed both data packages as well as laptops for their learners, their students to engage with the institution, but it may not be the case for someone in the middle of nowhere where there is not even access to the internet. During the hardest of lockdowns, some children could continue, even though limited that may be, with an electronic education. Many more could not. So it is true that these fault lines were made even worse by COVID. So
the priorities that the president raised, including one of a capable state, and that is right across Africa. There is need for us to strengthen the civil service for them to ensure universal access to the social wage, and thereby ensuring that indeed the demographic dividend becomes a dividend and not a demographic curse. Thank you, ladies and gentlemen.
Thank you so much. And in the absence, there is a hand. I'm not so sure. Bernard Onyago.
Yes, actually, so
you also have your hand up. So we have two hands. I'll start with Bernard and we'll come to Maxwell.
So I was interested, in fact, in the, when Maxwell was presenting, I think because of time, he wanted to present a few last slides. And since we have a couple of minutes, because I think there were some interesting findings there, I wanted to request if he could share that with us at this point, if no more questions.
Okay. How many minutes do you need, Maxwell? Because we were almost at a point of questions and answer session. How many more minutes do you need?
Thank you, Madam Chair. I will need probably 2 minutes to just come in on this one, because I was also interested in many things that were said by my colleagues there. I listened to the issue about the social protection that has been extended in the form of handouts and so forth and so forth. I just wanted to say that one of the things that we look to do, especially within the labor markets, is to strengthen the opportunities for employment so that individuals can sustain themselves without necessarily needing these handouts and everything, because there's a sustainability issue in there. It could be a case that, of course, South Africa, when you look at it across the region, can be able to do this. But at a regional level, you get to understand that this is not going to be possible across all the 16 member states. So this is where the issue of employment, which has been highlighted and also by the discussant, becomes very important, where we capacitate especially the young people themselves to work for their welfare. And when they contribute to social security as workers, they contribute to medical aid, they contribute to unemployment insurance and so forth. That form of social protection, as opposed to handouts, as opposed to social assistance, which is what we call generally social insurance, is more sustainable in the long term. So the answer that we would like to see in the next few years, in the next decade, as we go towards our SADC Vision 2050, especially lies in increased employment opportunities, especially for the young people. That is the only way that we will sustainably manage issues of poverty eradication in the region. And then this is why the strategy on industrialization in the region and in the member states comes in as very important. And this is where we then need to integrate the young people within the value chains that have been prioritized in agriculture, in mining, pharmaceuticals, which is a proxy for manufacturing or industry. It becomes very important to have people participating in these value chains, because handouts do not speak to a real social protection system that is sustainable, especially if you look at capacity issues across the region. A worrying feature, of course, if South Africa is very important for the region, but you notice that South Africa contributes about 58% in terms of the intra-region exports, for example. 58% goes to South Africa. But if you then look at South Africa and the world, you see that South Africa exports the value that it exports within the region vis-a-vis the world is about 22%. The value that it imports vis-a-vis the rest of the world is about 19%. And so this is extremely concerning. It means that the linkages within the region are not strong enough, and we need to build this. And of course, leveraging on South Africa itself as the most industrialized country within the region, but in a way that lifts all the other member states so that we can build this resilience, we can strengthen these value chains, we can promote this employment which is more sustainable within the region. So these are the things that I just wanted to put across. And as we strengthen our social protection, we make sure that employment, decent work, decent employment plays a critical role in terms of building capacity, including for the young people and also for the women. So this is what I wanted to highlight just in closing. Thank you, Chair, for that opportunity.
Thank you, Maxwell. I see we have a hand again from, is it Pintia or Fintia Goma? Are you the only one whose hand is up? Let me just check. Everyone that had an opportunity to speak, please lower your hand so that I can see. But Fintia, you're the only one remaining for now.
Thank you so much, Chair. I just wanted to find out from Lerato if she can maybe, in the interest of time, maybe have a presentation or maybe a one-pager, because I remember there were some things that she couldn't go through because of time in terms of a way forward. She told us the things that the youth are saying, the complaints that they are having, but there was no way forward in terms of what are they proposing or suggesting as the youth. So I just wanted to check, because I saw that she's the only one who didn't project a presentation. I saw on the chat that the presentation will be available on a link that was shared, but now I'm remembering that Lerato did not have any presentation. Is there a way of us getting what she wanted to share, but due to time she couldn't share? Thank you so much.
Lerato, can you engage us whether you can spend just 2 to 3 minutes talking to the outstanding issues, but also posting your speech or presentation so that it can be shared with everyone?
I think let me just do it, because it's not a lot of lesson way forward, okay, but it's something that we can do. And I can also just put up a one-pager, because I preferred not having a presentation, but just putting everything out there. So some of the lesson learned, and I think Maxwell and the others, they have echoed it in terms of the relief funds. So the lesson learned and moving forward is that what we can do is make sure that some of the relief funds, it's something that is made permanent, especially for young people who cannot get employment, because sometimes in terms of getting employment, you need to submit CVs, you need to travel. So you need to borrow money in terms of getting employment. So if it could be made permanent until you get employment, then that could also work. And secondly is that we need to be aware that we are moving into the 4th industrial revolution. So most of the conversations as they have started, we can continue with them. They are less they're less expensive, if I can use that word for a lack of better word, rather than having a lot of gatherings, and also helps most of the young people who are influencers into getting employment, even though they're not influencers like your Dr. Shakira's, who are traveling to get remuneration. It also assists them when they're having such conversations online, because they also get some sort of remuneration. And also make sure that we reach out to civil societies as young people, not have youth-led organizations on paper, but also ensure that those youth-led organizations, they sustain their own money rather than waiting for the UN agencies or the government to fund them. They can be probably consultancy, they can do consultancy work. That's one of the things that we can do to move forward. And thirdly, on the gender-based violence being on the rise also, we need to find a way of making sure that we are a sister's keeper. We have young people who have come up with PIN locations on cell phones, and making sure that our locations are always open so that we can, keep each other in the loop to know what's happening. And lastly, in terms of strengthening and sharing and encouraging young people to be on the loop and to solidify the share price and to be aware of what's happening on the JEC, teach them stocks and market and everything. So what we have concluded, as most of the young people that I've engaged with, is that the best thing that we can do is to explore, innovate, and engage in when it comes to everything, and not wait for solutions, because the moment we do that, that's when the economy continues. We cannot sit here and wait that when the rand is trading for 19 rand against the British pound. It shouldn't be like that. At least if we were to meet halfway, at least if it's 7 rand, then it would make sense. And it's only if we as young people, we explore, innovate, and engage and get people with I usually don't like saying older people. I say people with mileage to assist us with their knowledge and the power that they have. So yeah, that was the thing. But I can also put it on a one page so that you guys can have it. Thank you very much.
Okay. I'm just going to talk to the way forward, because it doesn't look like we have people that are posing more questions. Okay. Am I allowed to proceed? Fine. There's a hand. Is that Sibusiso again?
Yes, Chair, it is.
You can talk.
Thanks, Chair. This time it's not a comment, just a request. Can maybe I presume the Secretariat, which is the Department of Social Development, can they please share the presentations with us?
Okay.
Yes, thank you.
That shouldn't be a problem. Your request is noted, and we will deal with that. I'll just check the modalities, but it's something that we're noting, and it shouldn't be a problem. Can I now proceed to a way forward? I don't see any hand. On my side, there are a few things we need to note. What are the lessons here? But it is also noted that the programs that are meant to help South Africa and countries in the SADC are highly affected, and the impact is excessive, that we are acknowledging. But one of the strategic questions that we need to ask ourselves is that, will the region be able to recover from this impact? That's an area of concern. But some of the things that we need to do is to have an inclusive and innovative development approach, one that has a focus on the youth, putting the youth at the epicenter of development programs. We need to play an advocacy role and advocate for social rights in the region to reduce poverty and inequality, in particular, universal access to services, considered the social wage issues. Efforts to fight hunger must be doubled, but we need to focus more on the economic growth, for it has slowed down negatively, and it had a dire impact on the jobs or employment. Measures to improve diversified economic growth are critical, as the youth, women are the most vulnerable, including persons with disabilities. And taking advantage of the fourth industrial revolution, youth in technology and innovation entrepreneurships should actually be the guiding principle. Recovery plans must prioritize education. The long-term impact will be very big due to time lost, especially in the early childhood development sector. Resource mobilization initiatives within the region must include sexual and reproductive health services and rights. Gender-based violence and its drivers should actually be addressed. And we need to strengthen South-to-South collaboration in population and development in the continent. That's for me, from my side, in terms of the way forward. And the issue of the, my apologies, of sharing the presentations, we will definitely deal with that. And we're looking forward to meet with you at the next session. I do apologize for this. Let me then open my camera and express my gratitude to all of you who took part, to the speakers, our discussant, our participants, and secretariat. I'm looking forward to clear recordings of this session, and once we conclude, much more specific program of action in addressing some of the areas of concerns. I propose that we adjourn. And there's some few announcement apologies that we need to make. Let me check whether my colleague Vusi will be the one that deals with those announcements. If you can just hang on a bit. Vusi, I would like to hand over to you.
Lastly, would like to bring to your attention that our fourth webinar, there's an echo. That our fourth webinar will be happening next week, Wednesday, on the 11th of November, 2020, again from the same time, that is from 15 hours to 17 hours South Africa Standard Time. And also please note that a link wherein you can access all the presentations from all our webinars has been created and will be shared with you by our colleagues from AFIDEP. Those are the announcements. Thanks, and have a good day. Yes, that's it from me.
Take care, and thanks again to all of you. Goodbye.
Thank you. Good day. Bye.
Thanks. Bye.
Bye. Thank you.
Thank you. Bye-bye.